If your hands and feet feel like they're constantly buzzing, prickling, or crawling with tiny electric shocks, I want you to pause for a moment and really listen. What I'm about to share helped my 67-year-old patient regain sensation in her fingers in just 14 days, using something you likely already keep in your home medicine cabinet. For more than 15 years, I've worked closely with hundreds of patients over the age of 60 who were struggling with nerve-related symptoms. And what truly saddens me is this: most people living with numbness, burning, and persistent pins and needle sensations have no idea there's a simple approach that can bring real relief in as little as 2 weeks. Today, I'm going to explain exactly which B vitamin your nerves are lacking, why it works so effectively, how much to take, and the most common mistake CNEs make that prevents real progress. Before we continue, let me ask you a few important questions. Do your hands or feet tingle when you lie down at night? Do you have trouble telling if water is too hot or too cold? Have buttons, zippers, or small objects become harder to manage? Do you feel unsteady or unsure when walking? Or do you experience a burning sensation that never fully disappears? If you answered yes to even one of these, your nervous system is sending out a warning. And here's what many doctors don't clearly explain. This isn't just about discomfort. When nerve damage is ignored, it can lead to permanent loss of feeling, a much higher risk of falling, and a serious loss of independence and quality of life. But stay with me, because the solution is far simpler than most people realize. Let's talk about what's happening inside your body. Your nerves work like an intricate network of electrical wires running throughout your entire system. They carry messages from your brain to your hands, feet, and every other part of your body. Each nerve is wrapped in a protective layer, similar to the insulation around an electrical cord. As we age, especially after 60, the body becomes less capable of maintaining that protective layer. When it begins to weaken or wear down, nerves become exposed and start sending faulty signals. That's when tingling, numbness, and burning pain begin. Here's the crucial part. There is one specific B vitamin your body absolutely needs to repair and protect that nerve covering. Without it, healing stalls. With it, nerve damage can begin to reverse. That vitamin is B1, also known as thiamine. And before you brush this off as just another supplement trend, let me tell you what I've personally observed. I've seen patients who couldn't hold a coffee mug regain steady hands. I've watched people who felt unstable on their feet walk with confidence again. I've seen individuals return to gardening, cooking, and even dancing, activities they thought were gone for good. These outcomes aren't rare. They happen repeatedly when people restore healthy B1 levels. Your body is far more capable of healing than you may have been led to believe. Your nerves want to recover. They're designed to recover. They simply need the right support, and B1 provides that support. This isn't magic. It's basic human biology. Think of it this way. If you drove a car without oil, the engine would eventually seize up. Parts would grind, wear down, and fail. B1 plays a similar role in your nervous system. It keeps everything running smoothly, protects nerve pathways, and allows signals to travel clearly from your brain to the rest of your body. When B1 levels fall too low, your nervous system begins to malfunction. Signals become distorted. Sensations misfire. You feel pins and needles. Your hands grow numb. Your feet feel disconnected. Walking becomes frightening because you can't properly sense the ground beneath you. But when B1 levels are restored, healing can begin surprisingly quickly. The protective coating around your nerves starts rebuilding. Signals sharpen. Sensation gradually returns. Many patients tell me it feels like their body is coming back online after years of dullness. You might be thinking, I eat well. I probably get enough B vitamins. Here's the reality. A significant number of adults over 60 are deficient in B1, and most have no idea. Research suggests up to 1/3 of older adults don't get enough B1 from diet alone. And the risk rises even higher if you're taking certain medications. Why does this happen? There are 3 main reasons. First, stomach acid production decreases with age. That makes it harder to absorb B1 from food. A younger adult may absorb 60 to 70% of dietary B1, while someone over 60 may absorb only 20 to 30%. Second, many commonly prescribed medications reduce B1 levels. Diabetes drugs like metformin, water pills for blood pressure, and certain heartburn medications can quietly drain B1 over time, without any warning. Third, modern food processing removes B1 from many foods. White bread, white rice, and heavily processed foods contain very little B1 compared to whole, unprocessed foods. Let me share a real example. Robert was 71 and very health conscious. He walked every day, ate vegetables, and avoided junk food. Yet his feet felt numb, like he was walking on thick padding. He couldn't feel the pedals when driving. Blood tests revealed his B1 levels were dangerously low. His diabetes and blood pressure medications had been slowly depleting his B1 for years. Once we corrected the deficiency, everything changed. 3 weeks later, he told me he could feel the ground again. He felt safe walking and driving. He said it felt like someone turned the lights back on inside his body. Stories like Robert's are far too common. If you're over 60 and dealing with tingling, numbness, burning, or weakness, checking your B1 levels is essential. Early nerve damage can improve quickly. Long-standing damage takes much longer. Low B1 doesn't just affect nerves. It impacts energy, mood, balance, and memory. Many people blame aging when the real problem is deficiency. Now let me tell you exactly what to do. Step 1. Choose the right form. Look for benfotiamine, a fat-soluble form of B1 that reaches nerve tissue far more effectively than standard thiamine. Step 2. Take the correct dose. For nerve repair, 150 to 300 milligrams daily is ideal. B1 is water-soluble, so excess amounts are safely eliminated. Step 3. Take it with food that contains some fat to improve absorption. Step 4. Take it every morning. Consistency is crucial. Skipping days slows progress. Here's what most people notice. Week 1. Better energy and clearer thinking. Week 2. Early nerve improvement. Weeks 3 and 4. Less tingling and improved balance. Months 2 and 3. Significant, life-changing progress. Now let me return to Margaret, the 67-year-old patient I mentioned earlier. She couldn't feel her grandchildren's hands. She dropped everything she touched. She had fallen twice. A former seamstress, she couldn't even button her own blouse. Her B1 levels were dangerously low. We started her on 300 milligrams of benfotiamine. Within 14 days, sensation improved. Within 6 weeks, she was dressing herself again. Within 3 months, she returned to sewing. She made me a scarf and said it gave her independence back. Her body healed itself. It simply needed B1. Before you begin, keep these 3 precautions in mind. Get blood work if possible. Consult your doctor if you have kidney disease or take multiple medications. Inform your doctor if you're on diabetes or blood pressure medications. B1 works even better when paired with B6 and B12. A high-quality B-complex can enhance results. Here's your 4-week action plan. Week 1. Start benfotiamine and request blood work. Week 2. Add a B-complex. Weeks 2 through 4. Track symptoms daily. Week 4. Review progress with your doctor. This approach has helped hundreds of my patients, and it can help you too. If this helped you, share it with someone over 60. Subscribe for more senior health guidance. Your best years aren't behind you. With the right knowledge and action, you can restore comfort, balance, and independence, starting today.